Our project on the vulnerable population of single parents. How being a single parent affects the wealth of the parent and family. Single mothers are not able to fully devote their time to paid work without having an effect on their children. If the parent is working, they are paying for childcare. If they are not working and watching the children instead, they may not have a steady income. In the United States, the custodial mothers and children's standard of living is reduced by 30% on average. In cases of single parenting due to divorce, child support usually is not a significant amount of money. Teenage mothers face economic hardship with the interruption of their education, leaving them in their adulthood as unskilled, unemployed, and unemployable. Overall, women with dependent children comprise 2/3 of the poor population. When women work for wages, they make significantly less than their male counterparts. Even full-time employment does not guarantee financial security given the structure of the labor force. The United States and Canada have the highest wage gap of 75%. And children in single-parent families are twice as at risk of living in poverty than those in couple families. It's nearly almost double the percentage of those in couple families. In a comparison of women's unemployment, single mothers are nearly double and triple all married women or married women that own children. Some solutions are strategies to make ends meet. Asking for and accepting help from others is very important. The support and assistance that women receive and accept include micro and meso levels of support. They include relying on and receiving support from family and friends and community services. The women with close social networks stated that these sources of support assisted them financially for everyday expenses. And in the bartering system, in addition to the financial assistance they received, some of the women discussed the role of bartering and other informal forms of achieving financial security. And for practical solutions, they include structuring your money and implementing cost-saving strategies when shopping and looking for ways to also increase your income. And for teen single moms, it is important to finish education. How the financial issues affect the health of the parent and family. The participant's income had a statistically significant influence on their likelihood of reporting good health. For these women, as their income increased, they were more likely to report good health. They have better access to health care and even access to healthier food options and better grocery stores. Lower financial capability leads to a lot more stress, and stress has many negative health benefits. It weakens the immune system and causes high blood pressure, fatigue, depression, anxiety, and even heart disease. If money is a problem, single parents also might not be able to afford the health care they need or doctor's visits. The impact of financial hardship. Participants often questioned their ability to cope. They reported having sleepless nights, frustration, and distress. And participants often described feeling anxious about everything, suggesting that single parents were on high alert. Some single parents also described feeling judged by others. Some solutions would be to find ways to reduce stress. You can exercise, write feelings down, find things that make you laugh, reduce caffeine intake, light a candle, and set a daily routine. And set aside small amount of money every month to save for when a doctor's visit is necessary. You never know when an emergency is going to come up. Food banks are also a great source of support. Professional help is often sought out when participants describe themselves as having hit a crisis point. Psychologists and therapists are always there for an option. How being a single parent affects the health of the parent and family. The burden of being a parent, especially mothers, can pose so many health challenges. Studies indicate that a single mother in almost all countries had poorer health as they aged than women who were married. Single parents across all income levels are more likely to lack health insurance, and more than 20% did not have health coverage, compared to just 10% of married parents. Some solutions means readjusting your priorities. It is not easy to maneuver for moms who are already struggling to stay afloat. It is important for the mother or father to be healthy in order to provide the best care for their child. It is also important to stay positive and focus on what you have and what you can to keep yourself and your child happy and healthy. Self-care for single parents, staying healthy, make time for me time, ask for help, and remember to play. How the health issues affect the wealth in the parent family. Single mothers are more likely to be younger, less educated, and Black or Hispanic. Single motherhood is the strongest determinant of female poverty in the United States. There are plenty of solutions. Don't be afraid to ask for help, and asking for assistance can be extremely helpful. Community organizations such as churches and community organizations may also be available for temporary assistance.